about Arlington County. Okay.
Absolutely, I'd be happy to. Thank you, Elizabeth, and thank you.
I also want to add that we are recording this program, so for anyone who cannot attend right now, they'll be able to access it later. So my neighbors, behave yourselves.
And I'll just add, thank you, Elizabeth, and thank you for inviting us to come out tonight. It's so wonderful to be here with all of you, even though we're on Zoom. I will say that I am actually a neighbor of yours as well. I live on the other side of Wilson Boulevard from you, though. So, but right in the same neighborhood. So I could have walked over there tonight and met with you all. But anyway, next time we'll do that.
Next time for sure. Next time for sure. Yeah.
Yeah. So for those of you who weren't on when we were discussing the closed captioning, if you want to see the captioning as we're talking, if you just hover over towards the bottom of your screen, you'll see something that says live transcript towards the bottom. If you click on that, you'll be able to see the transcript. So you'll be able to see what we're saying as we're saying it. So just wanted you to know that that was out there. So I'm going to go ahead and share my screen. Hopefully this will work. I want to do this one.
Also, for while the presentations are going on, if everyone else could mute yourselves, please, and that way we won't get extraneous conversations. It'll be easier to follow along. And thank you all so much.
Okay, so can everyone see my slideshow here? Hold on, let me start that again. I was hoping to be able to see my notes as well as the slideshow, but we'll just go with the slideshow and see what we get here. So
you've got this, Helen. You got it.
All right, great. So good evening, everyone. Again, my name is Helen King, and I am the director of the Arlington Area Agency on Aging. The Area Agency on Aging is part of the Department of Human Services, Aging and Disability Services Division. So that's a whole lot of words, but we'll talk a little bit about what that means in the next couple minutes. But first of all, I would like to wish everyone Happy Older Americans Month. May is traditionally Older Americans Month, and it's just a time to recognize the contribution that older adults make to our communities, and you know, just have a way to make sure that we can highlight all of that. The theme this year is Age My Way. And so really very appropriate about, you know, to come here tonight and talk about aging in place and how we do that successfully. So anyway, Happy Older Americans Month to everyone. So just a little, we'll give a couple little statistics about older adults in Arlington. I think the last number that I saw was there's roughly 36,000 older adults who are 60 and older in Arlington. It makes up roughly 14% of our population and growing. Yeah. The older adult population is actually growing faster than the total population of Arlington. As you can see from this chart, the total population grew about 5% over the time period, but the older adults, adults 60 and older, grew 14%. So it's not. And if you look at the two age groups, one 75 to 84 and the other 65 to 74, they're growing even at a much faster rate. For a lot of reasons that Elizabeth mentioned, as well as, you know, our location, we have good access to healthcare, lots of universities around. There's many reasons why people want to live in Arlington. And so, you know, this is just fascinating and something that I love to track on how, you know, the older adults are doing in Arlington. So another statistic, 90% of adults age 65 and older say they want to stay in the home of their choice for as long as possible, right? You know, which is understandable. We like to be where we're comfortable, where our friends are. None of us want to think about having to go to a long-term care facility. But eventually, if we live long enough, statistics also tell us that we'll need some supports or services to be able to do that safely and successfully. And this is my final statistics slide, I promise. But this is just a snapshot of, for the Washington, D.C. area, what some of the costs of care are, right? So if you're looking at having homemaker services or a home health aide, you're looking at approximately $5,000 a month. And I think that's probably, yeah, it's assuming 44 hours a week. So roughly a person with you 8 hours a day. When we start looking at assisted living facilities, this number that they're quoting is an average across the area of about $6,000. We look at some of these new facilities that are going up. Some of them are upwards of $9,000 a month and higher, right? And then nursing home care, if you're looking for a private room, it's more than $13,000 a month. So pretty costly to have to go to a long-term care facility.
Yeah.
So before we get into the services, I'll talk just really briefly about the Arlington Area Agency on Aging. We're part of the National Aging Network. Across the country, these area agencies on aging exist, right? So any community that you go to, they have an area agency on aging. There are 622 across the country. They're mandated by the Older Americans Act. And we have a vital role in planning and in implementing services within our community. So the area agency in Arlington looks even different from the area agency in Fairfax and Alexandria, because we're looking at the needs of our community and what programs will best support. There are 25 area agencies on aging across the state of Virginia. And we all have key or core programs that we're required to implement: nutrition programs, caregiver programs, health and wellness, elder rights and supportive services. And then in addition to that, we can have other programs as well. And so programs like our Medicare counseling is in addition to the programs that we offer that are required, that are mandated by the Older Americans Act. So this slide here is just a quick view of the range of programs that we're offering out of the Agency on Aging. We'll talk a little bit more detail about most of these. We start with our Aging and Disability Resource Center. This is staffed by intake professionals who are versed in the variety of services and supports that are available in Arlington. They handle everything from phone calls asking for information about long-term care to requests for financial assistance, for food and nutrition programs, you know, the whole gamut. We offer programs for in-home services, for transportation, legal services. There's a couple nutrition programs, our social 60+ cafes and home delivered meals. Wellness programs, things like chronic disease self-management. We have a money management program, and then our senior farmers market nutrition program, which is one of our most popular programs. Especially, it's targeted to low-income older adults and getting them access to fresh produce at the markets during the prime season. So again, our Aging and Disability Resource Center is the front door, if you will, the no wrong door access point to all of the supports and services available in aging and disability services. So if you have any questions about programs or supports, or if you're a caregiver or a family member, if there's one thing you take away tonight from my presentation, it's 703-228-1700, which is the number to call to connect to our Aging and Disability Resource Center. So one of the most requested services that we get is for transportation resources. You know, as we start to age, we're maybe less comfortable driving around the area, or you know, we would prefer to take public transportation. Metro and Arlington Transit offer discounts to residents who are 65 or older. You just have to have that yellow Metro Pass card. Super Senior Taxi is available to any resident who is 70 and older, and that program allows you to buy half-price cab vouchers. So you buy a book that is valued at $20 of cab vouchers for $10, right? And then you can use those to grab a taxi wherever you want to go. The Senior Loops is a transportation program that we offer from some of the senior independent, below income, independent living residences to allow folks to get to the grocery store or to Target or to the bank. And then for individuals who need paratransit, so transportation that is accessible for handicapped individuals, there's Metro Access. And then the Arlington equivalent of that is STAR. So if you have Metro Access, you have access to STAR, which generally is preferred by our residents because it's not quite so busy, not as many people on the bus that you're riding with. And then within STAR, there is a temporary STAR. So for example, if you were to have to go into the hospital for surgery and you needed 3 or 4 weeks of this paratransit service, we can, with a doctor's note, we can set you up for a temporary access to STAR so that you can use it to get back and forth to your medical appointments. It is that one is only 2 medical appointments, but it's helpful when you're not able to drive. The nutrition programs that we offer, again, are available to all residents. Our Social 60 Plus cafes are our congregate meal program. They were shut down for a little while during COVID, but have been back for over a year now, and they're finally getting back up to full capacity. These are offered at Langston Brown, Arlington Mill, and Walter Reed community centers. And so it's just a place where you can go, have a hot meal, and they have programming in the senior centers. So if you were, looking for, to have company to eat a meal with or something like that, just stop in one of the cafes and they'd be more than happy to have you join. Our home delivered meals program are for individuals who are homebound, not able to easily get out and or to stand for a long time to make their meals. So with this program, we provide 1 hot meal and 1 cold meal for 5 days a week. And so, and the meals are delivered right to your door. They are delivering currently for most people 1 day a week, all 10 meals 1 day a week. But they have continued all through the pandemic and ensured that some of our most vulnerable residents have access to the food. And then for some of our lower income individuals at Culpeper Garden, we offer a meal subsidy, and then we connect folks to AFAC, the food bank, and then have nutrition counseling and education for individuals who are particularly high risk for, needing nutrition services. With our home-based service, we do have personal care and homemaker services. We also are able to connect individuals. Fairfax County maintains what they call a companion registry, which is pre-vetted caregivers in the community, right? So it's a list of individuals who, they've checked out, and so is a trustworthy source for finding care in the home if that's something that you need. And then there's also geriatric care managers in our community. So these are individuals who are social workers or nurse case managers who are well-versed in all of the services that are available and, and able to connect you to the supports and services that you might need. The Medicaid waiver program, again, is for individuals who want to remain in their home but are at a nursing home level of care. You have to be approved for Medicaid to access this, but it does provide a certain number of hours of in-home care to remain a little bit longer. And then we have a nursing case management program that just basically helps with the coordination of care for individuals who really don't have anyone else to kind of help them navigate the medical system. It can get quite complicated at times. Medicare counseling. So another program that is prevalent across the country are what's called state health insurance programs, SHIPs. In Virginia, we call it VICAP, which is the Virginia Insurance Counseling and Assistance Program. This is unbiased, free counseling resources and counseling for Medicare to help you understand and navigate the very complex healthcare that is our Medicare. And so we have trained and certified counselors available Monday through Friday during business hours, who can help you to sign up for Medicare, make changes during the open enrollment period, really sort of evaluate your situation versus what is available. And this is especially true with the Medicare Part D, the prescription plans. And then throughout the year, they offer classes on various topics, and just to make sure that you're as educated as you want to be on both Medicare and then also Medicare fraud. They work very closely with the Senior Medicare Patrol to help you identify and avoid Medicare fraud. We do have an adult day program. So if you're a caregiver of an individual and needing some respite, our adult day center is over at the Walter Reed Community Center. And it is a safe place for your loved one to go, so that it allow you to be able to go to work and not worry about, are they safe during the day, or are they being cared for? They're getting food, they get help with their medication, there's therapeutic recreation, they do all kinds of fun arts activities and other stimulating activities. It's really a great place. And then finally, in my last couple minutes, Arlington has a large number of advisory groups and commissions. I think last I counted, it was somewhere around 56 or 57. And that is true for the Aging Network in Arlington as well. We have the Commission on Aging. Part of their role is to serve as a mandated advisory board for the Agency on Aging, but they are primarily here for you. They are advocates to promote quality of life and ensure that your voice is heard in all of the county planning activities. And I can tell you they are a very passionate group, a very active group. They are, involved in things like the missing middle housing study. They are involved in a lot of the transportation and the Vision Zero efforts, as well as, looking at. So what's on here is the list of the various committees that are part of the Commission on Aging, and sort of the directing guidance not really guidance for the Commission on Aging, but sort of their guiding vision, right, is what we call the age-friendly network. So Arlington in 2018 was named the 250th age-friendly community in the United States. We do know we're pretty age-friendly already here in Arlington, but we also know that we could be better, right? And so AARP is spearheading this effort across the country. It is actually a World Health Organization initiative, and it's just looking at your community and what are ways that we can make it more livable for all ages, right? So if we make it more livable for older adults, we're actually making it more livable for everyone. And so what's on this chart here is the 8 domains. The Commission on Aging is really structuring all their work around this age-friendly initiative. And there is an age-friendly action plan that is listed out their first set of goals towards making Arlington age-friendly. And, they are actively working that through their work within the commission. And they're coming up on the end of their first 5-year planning cycle. They'll be setting up a new set of goals, either to continue what they've already started or to look in different directions. So what I would say is, if any of you are interested in the Commission on Aging, the work that they're doing, or the age-friendly initiative, I would invite you to attend some of our committee meetings or the General Commission on Aging meetings. They are still virtual right now, so it's pretty easy to attend them. The Commission on Aging meetings are the 3rd Monday of the month, every month except for August. And I can make sure that you get the connection information for that meeting if you're interested in attending that. And then The Commission on Aging does have a website on the county webpage, and we list all of the committee meetings, when they're meeting, where they're meeting. They also are meeting virtually right now. And so, the connection information on how to get there is also available. So I think that's my last slide. We'll pop up contact information, or I'll make sure that Elizabeth gets it so she can distribute it going forward. But any 703-228-1700 can get you to anybody there, including myself. If you just want to call that number and ask for me, they will connect you. So thank you very much. And I think if there's questions now, or do we want to wait till the end to hit questions, Elizabeth?
I don't know, what do you find works best, to field questions all together?
Well, we don't have people raising their hand right now. Maybe we'll just move on, and I'll make sure that I go fast so that we have time for questions at the end.
That's a good idea. I just want to say that that I have attended Commission on Aging meetings, and they're fascinating to see your tax dollars at work. I mean, the Arlington County government sends the commission information on decisions that they're reviewing, and gets input on what are the needs of older Arlingtonians. And then the commission sends it out to the committees to get input on all the different topics, the transportation and all those different topics. So it really is, it's fascinating to watch, the information travel from the person on the street all the way up and affecting decisions that are made at the county level. It's absolutely wonderful to watch. Thank you so much, Helen, for that presentation. And so we heard about what Arlington County government offers, and now we're going to hear about Wendy, would you say that the village movement came out of sort of a grassroots approach? Mm-hmm. So it's kind of interwoven, but independent of. Independent. So tell us, please, about this, how it got started and what you're doing.
Thanks so much, Elizabeth. So it's always a challenge, because I think when we present together, everybody sort of says, oh, we must be part of Arlington County government, but we're not. Arlington Neighborhood Village is a community-based nonprofit here in Arlington, serving Arlington. We work absolutely hand in glove with the county. And we couldn't exist without the partnership that we have with Helen's office, the Aging and Disability Center, and the Area Agency on Aging. So all of us work together to help older adults stay safe in their homes. So when you talk about Arlington Neighborhood Village, we are a network of volunteers that are providing the extra help you might need to age safely in your own home while staying connected to the community. And we're one step on that continuum of care that people might need. And Helen talked about that when she talked about the extra help you might need, and then, further down the path, if someone needed to go into either assisted living or a nursing home. So think that we have a continuum, and Arlington Neighborhood Village is one step on that continuum. We talked about this, we're neighbors helping neighbors age in place. We help with things like errands, transportation, small household tasks, daily check-in calls, and much more. I'll go into some detail in just a minute. And we're a strong social network that's looking to reduce social isolation. And as you can imagine, after 2 years of the pandemic, we're needed today more than ever. We were started in 2014, so we're celebrating our 8th anniversary at this point by a passionate group of neighbors who sat around their kitchen table and said, how can we help our neighbors who need extra help stay in their homes? Villages exist across the nation, not just here in Arlington. It was started 20 years ago in Beacon Hill. There are 300 villages across the nation today. If you know people in other locations and you want to know if there's a village in their backyard, there's a website, the Village to Village Network, that people can go to. Or even here in the Washington, D.C. area, we have more than 70 villages, 15 in the District of Columbia alone, and then villages in suburban Maryland and other villages here in Northern Virginia. So villages, it's a model, it exists across the country. I'm not going to spend too much time on this because Helen already covered it, but the answer is we know people want to stay in their homes for as long as they can. They want help. We know that staying in your home isn't easy. You need that extra help. It's for big functions and little functions, whether you need help because you can't drive safely anymore, or you need help to change a light bulb because you shouldn't get up on a ladder. But that help needs to come into your home, and it needs to come into your home from caring individuals. And we know while there are ways that we can hire people to provide that help, you know, hiring that assistance is really costly, and putting different types of assistance together can many times be overwhelming. And we know that many of our colleagues who have lower incomes feel all of these challenges even more acutely. So when we talk about what does Arlington Neighborhood Village do, and you'll see us abbreviated here to ANV. Transportation. Transportation had been our most requested service, and at this point it's coming back into the #1 service that we offer. So we have volunteers who will give people rides to medical appointments, take them to the grocery store, the bank, or the post office, or any other errand that they need to do. Volunteers who can help with minor household chores. We've got someone who needs to change their water filter underneath their sink. And that's a request that's gone out to our volunteers today. So not something that you need to hire an electrician for, but simply something that you need someone who knows how to use some tools can help you with. We offer technology assistance, and that technology assistance doesn't have to be a computer. It can be your smartphone, it can be your answering machine, it can be the remote control for your TV. You push the button and you don't know how it works anymore. We're friendly visitors and walking buddies, and we'll even do occasional yard work. And obviously these pictures are some photos of our members and volunteers over the past 2 years. I keep underscoring this, that we're neighbors helping neighbors. We're volunteers who are helping our neighbors stay in their homes and provide them that extra help and the social connection that they need. We also, along with the county, are offering wellness and education programs. We offer a Stay Active and Independent for Life, which is a fall prevention program. We help people get educated on a series of subjects. We do a weekly coffee and conversation every week, and we've done this for 8 years. Every week on Wednesdays at 10 a.m., we have a different speaker, and we've been doing those coffee and conversations over Zoom for the last 2 years. You can find the coffee and conversations on our website, and if we have a chance, I'll show you our website before we finish this conversation today. And then, of course, we get together. So whether that's a pop-up picnic, Thanksgiving, or other holiday celebration, we've got a happy hour crew, we've got a lunch crew, we have a bocce team that meets every Monday afternoon. We got a group of people who meet on Thursdays to play games in Ballston Quarter. You can see our ladies' lunch down here, and then pictures from some of our volunteers and members celebrating a birthday. So when you sit there and say, well, who's a member of A&V? Well, right now we've got 275 full members, and also what we call 80 temporary members. Membership does come at a price. So we do have an annual membership fee. That fee is generally about $500. There is a discounted fee that's available for people with lower incomes. So if your income is less than $47,000, for example, the fee is only $100, and it goes down from that. But in addition to our full members, we've also been helping 80 what we call temporary members during the pandemic. And those temporary members have not paid a membership fee at all. We felt during the pandemic that if there were at-risk and in-need seniors who needed our help, we didn't want to sit there and say, we can't help you unless you pay. So we've been helping these temporary members, generally with getting food from AFAC, as Helen talked about. So our members are 58 to 100 years old, but I have to tell you, most members are over 70 years old. And you can see that many of them, 43%, are over 80 years old. Again, most of our members are female, 27% are male, 68% of our members live alone, And of those who live alone, again, the vast majority are female. I mentioned briefly that we have the membership fee. 30% of our full members are right now receiving help with the membership fee due to income. So we do have a robust and generous financial aid fund. And we're working to expand the diversity of our village. So right now, about 16% of our members represent diverse backgrounds. I'm going to keep underscoring, how do we get the job done? Volunteers, volunteers, volunteers. We've got more than 100 drivers. We've got 213 active volunteers who are providing all the other services that we've talked about. When we look back at 2021, we fulfilled 2,680 service requests. Our volunteers drove 30,000 miles. They donated 8,600 hours of service. And we're really pleased to say that 97% of the requests that we got from our members were fulfilled. We want that percentage to be higher, but 97% is a really good number. But in addition to these volunteers that do all this direct service, we have volunteers who work behind the scenes to help run the village. This is a volunteer who's in our office and is taking phone calls from members who have requests. The other pictures here are volunteers who are either doing deliveries of groceries or helping members get to medical appointments or to church on Sunday. We have a staff. We have an executive director, that's me, a member services manager, a volunteer coordinator, a care manager. All of these positions are part-time. You can see this is our crack financial team here, looking at the computer screen and doing some bookkeeping in our office. The way we sustain ourselves are 3 streams. I mentioned briefly the membership fee. We also compete for grants, and we seek donations from individuals like yourselves who want to support our work and want to see the village survive. As much as I sit here and say we have volunteers, 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 we do also have expenses. So our expenses are all of the part-time people that I've talked about up here. Our expenses are the rent that we pay for an office. We're located in the Church of the Covenant on Military Road. We have expenses for our computers and telephone services. We have insurance. All of our volunteers are vetted. They go through background checks, and that costs money. We print some materials. We've got our website. So you can imagine that there are expenses that we incur. Right now, our expenses are about $240,000. So your membership fee, grants that we get, donations, cover those expenses of $240,000. Much as Helen talked about, Meals on Wheels operated, completely during COVID, we too were in continuous operation. We never closed. While admittedly some services were scaled back, others increased significantly. So we did less transportation, more errands. Although now that here we are in 2022, we're coming back to pre-pandemic levels for all of our services. We did education and social events. Everything moved to Zoom. We offered Zoom training for people who needed it. But like with your association at the Williamsburg, everybody is comfortable. Many people are comfortable. I shouldn't say everybody. Many people are comfortable getting on Zoom. We've got a phone buddy program. We even have a program where some people dial in and call us every day just to make sure that they're okay. And we're really pleased that we were recognized as a COVID-19 hero by the county board in January of 2022. I mentioned that we waived our membership fee during COVID to help at-risk and low-income seniors. That was really important to us because it gave us an opportunity to develop our partnerships with other senior serving organizations across the county. We now feel that we're part of Arlington's senior safety net. We want to grow even further, and we want to do more. I mentioned again briefly that we have a discounted membership program. You have a chance here to see some of those numbers. So again, if your income is under $47,000, our membership fee is $100. If it's under $36,000, it's $50. If it's under $26,000, it's $25. So we have a very generous financial aid program for people who need it. and about 30% of our people are participating in that program. And the reason we can do it is because we've had, really strong support in our fundraising campaigns that we do throughout the year and competing for grants. So what's next? Where are we going next? We're growing. I mentioned that we used to be 200 members, 220 members, and now we're about 340 members. So we're growing. We've just approved a 5-year strategic plan. We hope to expand our services to even more seniors across the county who need our help. We are forming really strong partnerships with the Arlington Partnership for Affordable Housing, with AFAC, with AHC, with Culpeper Garden, and with Helen's office and others in the county. We want to strengthen our financial aid fund so we can bring in even more people at lower incomes, and we want to diversify our income stream so we're not overly dependent on any one source of funding. I want to take just a minute to talk about volunteering. Everything I've talked about so far has been about being a member and getting services. But for those of you on the call who are interested, we also are always looking for volunteers. We can never have enough volunteers. So I want to encourage anybody in the audience who's thinking about volunteering to get in touch with us. I think I'm telling you what you already know, that volunteering is an incredibly rewarding experience. You're giving back to your community, you're helping others. Our members are extremely grateful for all that they get. And you as a volunteer have an incredible sense of well-being. When you want to be a volunteer, you've got a lot of choices that you can make. You can use your career skills and continue to do whatever that work is, if you're in technology or in communications, or you can build new skills. When you build new skills, I sit here and say you can use your brain or you can use your brawn. You can come in and help us on communications, or you can become a driver or someone who goes into someone's home to help change a light bulb. You can do anything you want with us. Your schedule can be a set schedule. Our office volunteers come in 1 day a week, or you can be a flexible schedule. You look at your calendar for the week and say, I'm free on Wednesday. I can give someone a ride on Wednesday. So we're incredibly overall flexible in terms of the volunteer experience you get with Arlington Neighborhood Village. How do we find our volunteers? Meetings like this, we go onto our online sites, word of mouth. There's an application on our website. We do Zoom training. You get a volunteer handbook. We do background checks for all of our volunteers, and we also look at their driving record. And once we go through that process, you get activated and engaged, and you're on board. And in closing, I simply want to say that when you're looking at Arlington Neighborhood Village, you're looking at members and volunteers who care deeply about each other and want to help each other and support each other. We want all of us to be able to stay in our homes and community safely and independently for as long as possible. And we are a network of volunteers that's trying very hard to make that happen. So my contact information, my email, our web address, our phone number, much like Helen said, remember 703-228-1700. I would also say, remember our phone number, 703-509-8057. And with that, I'm going to stop and open it up to questions from our audience. I know people are always reluctant to ask that first question, but here's Mary E. Mary, remember to unmute yourself when you ask that question.
Thank you. I just want to thank you guys. That was very professional presentations from both of you. I'm turning 65 this year. I'm been thinking about what I wanted for the future here, and we like the Williamsburg has the condos were built with like wide aisles and stuff and things to put in to help us age in place even years ago when I first bought it. And how I've been picturing things that I would like is the kind of thing that I know that people move into another place for, which is that early you're still mobile and
Right.
stuff, and you don't need a
Independent-
lot of help, but
You
you
can
might
go into
want
independent
somebody
living.
to check in on you. Yeah, but without moving somewhere else. And I didn't know if there was actually, I mean, your volunteers are doing that kind of thing, but I didn't know if there was any way of having a, or if there's a mechanism for this, if like people here subscribing to something and have it kind of condo-based contract, if you will. This unit, this unit, this unit, and this unit need help. And I don't know if that kind of model is anywhere being used, or am I
So
at all?
Mary,
I was just curious about that.
Yeah, no, I think you're asking an interesting question. You know, we can't speak for what you're doing in your condo building. But I think you're talking about the idea of like a little village itself, that you would have neighbors who would be checking in on each of you or some subset of you.
Yeah.
And making sure everything's okay. You know, I think I'm not aware of any building that does that right now. Doesn't mean it can't happen. But it's really a matter of a group of people within the building saying, this would work for us. How do we set it up? And it's sort of like, you've got to be a self-managed work team to put that in place.
Yeah, that's what I was wondering, if other people had done any of that kind of, or if there were groups of people who actually marketed themselves to buildings, like, we will provide the service for, sign up for our subscrition.
Yeah, so there's organizations like, there's a phone chat service, for example, it's a not-for-profit. I think they're based primarily in Fairfax, but it's a Northern Virginia-wide service. So, you can subscribe to their service and somebody will call and check on you, right? But it would be an individual thing, right? Like Wendy said, if it's something that you as a community wanted to do, that would be it would be a great and neat thing. I haven't heard of it in any communities, but that doesn't mean it doesn't exist, right? And similarly, kind of, one of the things the Commission on Aging is looking at is what they're calling a senior ambassador program, right? And so people in the community who are trained on all of the services that are available. So, somebody say like you, Mary, or maybe Elizabeth, right, that is part of this senior ambassador network that then is bringing these resources and information into the Williamsburg, right? So it's not exactly completely what you're looking at, but it is yet another way to connect, all of you on what resources are available. But it is really a neat idea that you're considering, and there ought to be a way to make it happen. So,
but Mary, I'd also say, outside of the Williamsburg condominium, that is what the village is. So we have people in our village. We have 12 people who every day call the office and say, I'm alive. They're worried that they may have taken a fall during the night and nobody knows that they are falling. And so they call the office every morning, or they email us and say, I made it through the night, I'm okay. And if we don't hear from them, we reach out to them and say, you didn't call us, where are you? And we escalate over the course of the day if we don't hear from somebody. And we sit there and we'll call their neighbor and say, go knock on the door, see if they're okay. And we'll talk to the concierge in the building and say, we didn't hear from Mary, is she okay? So we offer that daily check-in service to make sure people are okay. And then, in terms of services, that's what we do as a village. If you need to go to the doctor, you call and, we'll find a volunteer to take you to the doctor. You don't have to limit it to your building. Think of the Arlington Neighborhood Village as that wider network. Elfrida, do you want to have a question or comment? Remember to unmute yourself.
Sorry, something's wrong with the video. So firstly, I just wanted to let the group know that I am in the Arlington Village check-in program, and I do tend to call in every morning from Monday to Friday. I just hope nothing happens to me on Saturday and Sunday, however, because the program runs from Monday to Friday. And I have found it to be very helpful because, you know, sometimes I am so busy, I forget to call, and they always call or send me an email around 4 o'clock in the afternoon saying, "Are you okay?" Is it so? That has been a great source of comfort to me, that at least, you know, if I'm lying unconscious somewhere, someone will come and see me in the next 24 hours, sort of thing. The other thing, I've been a member of the Arlington Neighborhood Village for many years, and I've really found it to be an organization full of very dedicated volunteers who go out of their way really to help people as best they can. I have another, just a quick comment, and this is, I'm also a member of the Clarendon Courthouse Civic Association, and I live in the Metro Corridor. As Helen may know, we are currently in the process of doing the Clarendon sector plan, is currently being finalized. And as an association member, we keep going back to the county to say, are you taking the needs of our aging population in your plans? Because as I see the plans, there is less parking in the newer buildings, sidewalks are being narrowed, and also it's difficult for people to be walking on a wheelchair or if they're using a walker along there. Rents are high, property taxes are up. And, you know, a lot of this is driving the older people out of Arlington. And so I was just wondering, Helen, if the Agency on Aging gets involved in the planning process, and at what stage do you get involved in it? Thank you.
Thank you for that question, Elfrida. So the Agency on Aging itself does not get directly involved, but the Commission on Aging does, right? And so they are very active in the planning process. So for example, a couple years ago, and I'm going to blank on the name of it, but an assisted living company bought a piece of land up in Cherrydale and wanted to build an assisted living / memory care. The Commission on Aging is very interested in ensuring that there is affordable assisted living in Arlington. I don't know how much any of you know about the costs of assisted living, but it is very expensive. And especially in the state of Virginia, there is very limited assistance to help pay for the cost of an assisted living. There's much more available to help with paying for nursing home level of care, but for assisted living, there's almost nothing. And so the Commission on Aging right now is very involved in making sure that that bell gets rung on a frequent basis for the county board. They are, so that the Housing Committee is looking at a lot of the, they get involved when it gets to like the Site Plan Commission. So they're looking at, they've also through the age friendly network, through their age friendly goals, they've developed what they're calling a universal design checklist. So for things that the developers aren't required to do, these are some of the things that we would like to see in the new buildings. So like covered entryways, easily opening, main doors, because some of those doors can get quite heavy if they don't have one of those automatic door openers, the wide halls, the grab bars in the showers, all those things that are important to be able to stay safely in your apartment or in your condo. So I don't know, I haven't heard them yet talking about the Clarendon sector plan. I will also mention the Transportation Commission or committee is very involved in the Vision Zero activity, which is about making our streets safe for pedestrians and looking quite frequently at the numbers of accidents and injuries to older adults on the streets of Arlington. And so they too are raising that awareness of the safety of our older adults is very important. So like I said, I haven't heard any noise yet about the Clarendon sector plan, but I'm sure that they're looking at it, and we'll be making sure that you know, that your voices are heard, the voices of older adults are heard in that planning process.
Thank you.
Mhm.
And, you know, Elfrida, I'm just going to say, we all need to go back to the 60s and we all have to raise our voices. So as much as the Commission on Aging and others are going to raise their voice, you get to raise your voice too as part of the citizen input to the Clarendon sector plan. They,
Yep.
you know, this is a story. People have to hear it time and time again. They have to hear that the sidewalks, you know, aren't smooth, that when there's a crack in a sidewalk, that's where somebody's going to take a fall. That's where someone's going to, you know, break a wrist or do damage. And, you know, it's not fancy and sexy like talking about Metro, but it's very simple and it's something that we all do every day walking on the streets. So we've all got to raise our voices and
Well,
make sure
well,
that we do
Wendy,
that.
we do that, you know, at the Clarendon Association. We keep raising our voices. We write letters. You know, there's one person, our chairman is very active. So, but I don't know. It seems like the needs of the developers and what they want always take precedence over the needs of the community in a way. Not always, but often. So anyway, I don't want to spend too much time. Just wanted to know if there was anyone in the county who was also advocating for seniors, because we're just a group of volunteers outside.
Yeah, no, and I will say, you know, just two quick comments to that. So the Commission on Aging is very, very, very active and very vocal in advocating for older adults. The county board will even say, you know, that group is particularly vocal and active, right? A very rambunctious group, I think, is what they use to describe them. But the other thing that I will say, you know, a silver lining out of COVID has been that, you know, there is now an opportunity to participate and offer public comment at the county board meetings and a lot of the commission meetings virtually, right? So you don't have to, you know, go to the county board meeting and sit there all day long and wait for that opportunity to offer public comment. They have now instituted a process where you can provide that public comment virtually, right? And so you sign up for it a couple days before the meeting, and then they'll give you instructions on how you offer that public comment. So that will continue, you know, probably forever now, because it's something that they had wanted to do and just couldn't figure out how, and COVID forced them to figure out how to do it. So that definitely is an option. And Elizabeth, I see you have your hand up. You're muted, Elizabeth, maybe? We can't hear you. No.
Yeah, I'm sorry, Elizabeth, you're not muted, but we can't hear you. Isn't that frustrating? Maybe you can write it in the chat and we'll make sure everybody hears it. Well, Elizabeth. Well, Elizabeth's writing in the chat. Are there other questions from folks?
I had a question for Helen, I guess. The VICAP you mentioned, as I said, I'm turning 65, so I have this confusing Medicare stuff I have to take care of. And that's email from people saying, we'll help you, but they seem like they have a vested interest in a certain plan. So I was thinking that, as I wrote down VICAP is what I managed to write down. That's the group that will give me that's the truly disinterested, helpful group.
Yeah, so a lot of those messages that you get are from brokers, right? So they may say, we'll offer you, you know, or we'll connect you with what was most helpful for you, but they really are vested in offering you their plan, right? And so if you are looking at, you know, signing up for Medicare for the first time, you're getting close to that initial enrollment period. that's exactly what the VICAP team is there for, right? They will help you look at what your options are. They're not going to give you the answer, but they will help you organize the information so that you can understand it and make the right decision for you. So absolutely reach out to the VICAP team. That's what they're there for. And they'd be more than happy to help you.
Okay, can you hear me
Great,
now?
thank you.
Yes, Elizabeth, we can hear you.
Yes.
Okay, so we're at the end of our hour. Some people may need to log off. You had very kindly offered to stay a little longer if people had questions. But before we lose any audience, I just want to offer a formal thank you for your, wow, we learned a lot. Thank you so much for your time and your expertise and what you guys do every day to benefit our older residents, myself included, all of us that are getting older and grayer every day, not just for what we need today, but for those of us, I'm 59 and I'm planning ahead. You know, I just want to know what's available for me as I get older so that I don't wake up one day and say, wow, I can't do this. Now what do I do? I want to be able to have a plan in place and maintain my independence that way. So that was my main goal for wanting to have you do this program. My question is about the continuum. Wendy, you had mentioned, maybe starting with volunteers if you have trouble reaching things in your apartment, or if I loved your example about you push a wrong button on the TV remote and now you can't even get in there. Boy, I understand that. So my first question really is about help in the home. Helen, can you talk a little bit about how that works? How would that work to have help come into our home through the county in terms of maybe an aide or PT, or what kind of help comes in, and how do we pay for that, and how much help comes in? How does all that work?
Right. So the general answer to your question is it depends, right? But the programs that are offered through the county for the aides, they are limited in the services that they can offer, right? So they're generally like a homemaker service. So if you need help doing laundry or maybe some light housekeeping, that kind of thing, the service that is offered through the county is generally, we're looking at, 3, 4, 6 hours a week, somewhere around there. Okay.
Yeah.
And it depends, it all really depends on what you need. You might find you have more flexibility or can get really what you want by hiring a private aid service, right? And that's where the companion registry that I spoke of that Fairfax County maintains can be useful, because it's individuals or it's companies that have been vetted already. So you're not just opening, say, for example, the retirement living source book and trying to figure out, is AAA home health care any good, or, that kind of thing, right? That particular list has people who have been vetted. And then you would just negotiate with them they list out kind of the services that they offer. And so you could just negotiate with them and say, here's what I think I need help with, just come to agreement on what the hourly cost might be or what the task cost might be, because they can price it kind of 2 different ways, right? It can be an hourly rate or it can be a per task kind of rate. And so
I'm sorry, are these individuals like Jane Jones is placing herself? She's a certified nursing assistant and she's placing herself on the list. Okay.
The companion registry generally is individuals who would offer that service. And then the retirement living source book is a really excellent resource for connecting to that continuum of care, right? So starting with the in-home services and going all the way through nursing homes and memory care options, right? The senior retirement living source book is like an advertising publication, but it's a consolidated resource with a lot of information in it, right? So we get a lot of requests for that, and you can look at it online, or we get their magazines. They publish them like every 2 or 3 months. you know, and can send one out very easily. So.
Yeah. Thank you.
I mean, it's
Could you-
for those
could
of
you-
us old enough, it's like the Yellow Pages.
Yeah.
Except it's better than the Yellow Pages.
Exactly.
But
Yeah.
it tells you everything that's here in Arlington and the services that are offered. I mean, we have some good home, you know, Helen talked about the companion registry. So Elizabeth, you started the discussion saying there's a continuum. And there is, you know, there's the continuum. You're living independently and everything's fine. Next step, something happens. Either you're not driving anymore, you've taken a fall, or maybe some chronic condition has worsened. So you need some help. Can that help be offered by volunteers? So the village may be a stage in that continuum of care. You've raised a question and talked about home care aides. You know, the village, for example, doesn't provide personal care. Our volunteers don't cook meals. They don't help you bathe. They can't change a wound. We're not trained healthcare providers. So maybe you need a home care aide or a home health aide. And you can do that either through the companion registry and look for an individual, or you can do it through some of the companies that are here in the Arlington, Northern Virginia area that have really good reputations. So that you can go to one of those companies and find somebody who's going to come into your home and help you. There may be a point in time that you do need to move, and that you can move to an independent or assisted living facility. And again, we've got a variety of those kinds of facilities here in the county, from Goodwin House to Brookdale to the Jefferson to Sunrise. Outside of the county, you've got Chesterbrook and many in Fairfax, yeah, Ashby Ponds, Green Springs. We could list many more. One of the things you want to do is, while you're still able to make decisions and be mobile, visit all of these places. Figure out what they offer. Figure out which one might be right for you if you need to take that next step and move somewhere else. But you can move into assisted living, and then you know, as you get further down the continuum, it could be nursing home care and or hospice care. So it's really a recognition that there's a long continuum. Yeah. And you should educate yourselves at the front end, so that as you need these different services, you know what it is you're looking for, and you have some sense of where you want to land.
Yeah. What I like to say is treat ourselves the way we would treat a parent. So we wouldn't wait till the last minute. We would plan ahead, we would visit, we would become knowledgeable. If you have a kid who's going off to college, you don't wait till the last minute. You do some research ahead of time. You know, you're on a trajectory, but we tend to forget that. We get to middle age, and then we sort of think, okay, that's it.
Right.
That's not it. We have a long way to go. Wendy, I have a question for you. Do you ever tap into any of the local high schools who have volunteer, you know, kids who want to volunteer to either achieve required volunteer hours, or just smart kids who want to?
Oh, you're raising a sore point. You're raising a sore point.
Sorry.
For the time being,
you don't have to answer it.
No, I'm happy to answer it, because we debate it all the time. For the time being, we ask that our volunteers be 18 or older.
Okay.
And for our drivers, we ask that they be 21 or older. Yeah. We don't want new drivers. We want people with experience under their belts.
That makes sense.
And some of the challenges with younger people is, you know, just a question sometimes of the kind of supervision that they need. Yeah. You know, when you're going into someone's home and the person may be, you know, as I said, our members are older adults. They're not 60-year-old people. You want to make sure that you know who's in control in the situation, and that there's, you know, security and confidence and trust. Yeah. So we tend not
maturity
to
levels. There's a wide variety of maturity level, and even
right.
Yeah.
But we debate it all the time.
Yeah. All right.
Other questions from anybody? I know we've got a lot of people that are on their phone lines or something.
Thank you very much. And how many people is still in the watching this video?
We got about 17 people on the call right now.
Yeah. But they are there?
Yes.
Yeah.
Because I have a comment I would like to do. For people that is interested, have nothing to do with the great presentation that you did, but is about having classes by Zoom.
Mm-hmm.
There is a group, I'm having fall prevention classes twice a week, Tuesdays and Fridays from 12:30 to 1:30. No, from 1:30 to 2:30, are completely free and are very, very good classes. And we can take it on Zoom. If anyone is interested, they can send me an email and then I can send them back the information, because the next group of classes started yesterday.
Who is
I
it who's
missed, I missed the subject matter, Marissa. What is the subject of the classes?
Fall prevention is what they call SAIL classes. That is SAIL,
Oh, the sale. Mhm.
yes, stay active and independent for life, and are very good. You can do whatever, but I can do everything, you know, it's great.
Yeah,
Well,
it's a,
I want to build on what Marissa just said, and she's right. The SAIL class, which is Stay Active and Independent for Life, it's a fall prevention class. You know, the other
Yes,
thing that everybody on this call should know about is Arlington's 55+ program. You know, we started this talk together today, talking about the incredible wealth of resources that Arlington County has and offers to its citizens, and like the unspoken, untold stories is of the 55+ program, which comes out of our Department of Parks and Recreation and is a 30-page catalog.
yes, but I found it at 55, but now I have the direct information from Marymount University.
Yes.
That is the people that is holding that. So if anyone wants me to email them back the information that I just received, my email is marisa_manus@yahoo.com.
Marisa, that's great. The SAIL class is wonderful. And if you can get more people in it, more power to you.
Yes.
Yes.
wonderful.
It's
Thank
a
you for
wonderful
sharing.
program. There's a Falls Prevention Alliance that's run out of Marymount University, and they've just actually opened up a center for optimal aging. And so there will be much more coming out of Marymount University for the older adult population over the next several months, I'm sure.
Yes, and these classes are very good, and the teachers are very good, and they take it very seriously, you know.
Good, good. That's good to hear. Thank you for that feedback, Marissa. That's wonderful to hear.
Yes, so anyone that wants me to send them back the information, they can send me an email. I think it's going to be the easiest.
Thank you.
Perfect.
Thank you. Thank you. All
Any
right.
other questions?
Any other questions? Check the chat box. No, I think we're good.
No.
All right. Wendy and Helen, you guys rock. Thank you so much. We learned so much. I think we're in very good hands. And we'll have you back again.
Sounds great. Anytime.
I think we both want to come back when the wine and cheese is flowing.
Oh, good. That is a promise. One day we're going to get back to those in-person gatherings. It was lovely to meet both of you. I'm sorry it was virtual. I look forward to meeting you both in person one day. And my neighbors, thank you for joining us. It was lovely to see you here on screen. I look forward to seeing you in person very soon. Thank you for joining us for this program.
Okay.
How do we get the
1 minute.
recording? How do we get the recording?
I can make sure that we're going to put it up on we'll put it up on our YouTube channel, and I'll
Okay.
share the link with Elizabeth, and she'll be able to forward it to people.
Perfect. Okay.
And I just wanted to take a minute just to say, this is our website, www.arlnvil.org. And I
Yep.
mentioned the fact that we had those weekly coffee and conversations.
Yes.
So you can see our calendar here, and you can go in and look at the calendar. And when you're in the calendar, you can see all the different things that are happening.
Yeah.
And, you know, at any one point, go to one of these items, just click it. It'll open up bigger. You'll see who it is, who's our speaker, and you'll have the Zoom link right there to make it easy to connect.
Delegate Patrick Hope.
Yep. Yes, so the calendar is right there on the homepage of our website. You can get it easily. And as I said, everybody can join our coffee conversation.
Tai Chi, I've heard, is really good for balance too.
Yes.
Absolutely. Absolutely. Okay, that was my last advertisement.
All right, we love it. Thank you,
All
thank
right.
you, thank you. We've really, it's been a very enjoyable as well as educational and informative. And be well.
Thanks,
Okay.
everyone. Stay
Thank you.
safe.
Bye.
Bye-bye,
Thanks,
Bye-bye.
everyone.
everyone. Thanks for coming.
Thank
Bye.
you.
Thank you. Bye.